So I'm just going to do some quick introductions so you know whose perspectives we're hearing. So to my right is Cosima. So she's a doctor, a health tech consultant, and also an entrepreneur. She's a product manager at Outcome-Based Healthcare, where she's working on a project that's uniting sensor data and machine learning to try and understand health outcomes for diabetics. She's also an academic foundation trainee in Psychiatry and Psychological Medicine at St. Thomas's Hospital. And she's a graduate of Singularity, Oxford, and King's College London. To her right, we have Ben. Ben's a practicing doctor and a senior fellow to the CEO of NHS England. He's advised on over 100 billion worth of annual health spending with a focus on innovation and technology. He's also co-founder of the NHS Innovation Accelerator and the NHS Diabetes Prevention Program. He advises a number of entities, including the Swiss government and the WHO. He's also a well-published author and is a graduate of Oxford, Cambridge, and Harvard. And to his right, our final panelist is Reza. So Reza is head of science, EMEA, and special projects lab at AIG, a large insurance company, where he builds and leads teams that use machine learning for research and for products within the business. He's also a fellow of the Oxford Martin School at Oxford University, where he leads a program on machine learning and biomedical informatics. And he holds a DPhil in computational neuroscience and imaging and machine learning from the same university. So with that mouthful, I think we'll hear some really great perspectives. And so our topic again is how AI will enhance and personalize healthcare. So to start things out, I really wanted to get an idea for what we're actually talking about. So when we mention personalized healthcare, what is the opinions that you have to define that? Like what is it about healthcare that needs to be personalized?
So I think it depends on what stage in the healthcare process you're looking at, because we've heard from lots of really amazing innovations and amazing research that's happening, but obviously artificial intelligence is something you can apply to almost every aspect of the stream of when a patient is well to when they're sick to when they're discharged. And I think at each point along that stream, there's different parts of personalization. So I look a bit at, with outcomes-based healthcare, how can we personalize the understanding of someone's health outcomes from a different perspective, not just their clinical metrics, but equally you can personalize the way in which you diagnose and personalize the treatment. We've heard about, genomics and drug discovery. So for me, it's kind of, there are different verticals all the way along that chain.
Yep.
Yeah, so I think in healthcare there are 3 trends that are really going to transform the face of medicine over the next 5 to 7 years. One is genomics and personalized medicine, the second is data and digital, and the third is hardware and wearables, just to provide some context. In terms of a bit more detail about each of those buckets, so in genomics and personalized medicine, now with kind of 23andMe and other companies providing opportunities for people to sequence their own genomes at a fraction of the cost of, let's say, 5 to 10 years ago, people have more personalized information about more intimate parts of their health. That's coupled with a movement when it comes to pharma and therapeutics from one size fits many to one size potentially fitting one. And so that's genomics and personalized medicine. On the data and digital front, we've seen digital influence so many facets of our society, be it how you get a cab to how you date to how you do personal banking. And now it's time for healthcare to enter that spectrum and us to see digitalization, but in turn democratization of healthcare, touching again on the personal aspect. And then with hardware and wearables, we're seeing devices like the iWatch, smartphone, ECGs that are portable, each of these permitting better interconnected health, allowing for monitoring, diagnosis, and management to occur all at the same time. AI, in turn, is going to serve as a thread that combines all 3 of these buckets. And will be applicable to enhancing each 3 of these verticals that we're going to see really take off in healthcare. So that's kind of where I see it.
Hard to add much at this level of question, but I think pretty much what the panel said so far is a good summary. But making the answer a little bit more machine learning-y, I think based on what I'm doing these days, mostly around modeling the pathways and stuff, you can think of personalized healthcare as in using machine learning aspect of it, if I say only. It's about having a better understanding, a personalized understanding of the pathway of each individual within healthcare systems within their lifetime, as well as using insight that machine intelligence can generate to advising them on pathway to health. I mean, it's definitely more difficult than done than said, but generally it could be summarized that way, I would say.
Yeah. I mean, certainly in the therapeutics space, we've seen a lot of advancements with personalized and targeted therapy, which has yielded very significant impact in outcomes. But like when you look at some of those other areas that we've been talking about, like in terms of workflows and communication between doctors and patients, for example, like why is it that the current system is not personalized, and why is it that you can imagine a step change if we can personalize that process?
There's an interesting question there, because I think we see a lot of the personalization coming into areas, specialist medicine, with cancer, you know, with particular kind of specialist issues. With the vast bulk of healthcare, at least in terms of what I do, it's very pro-formalized, so it's very kind of one size fits all. And when you look at the kind of, so it seems like machine learning and personalization can come into either the health management space with patients managing their own health, or into specialist care. But then the kind of factory model of healthcare that we have, it's really hard to personalize it. We don't, you know, we prescribe paracetamol at the same dose for every single person, depending on, you know, it should be prescribed on weight and all these kind of things. The idea of pharmacogenomics coming into the bulk of healthcare is really, really far away. And so, and that relates to the communication side, is that the problems that we have in the bulk of healthcare are really basic. They're not yet at this level at all.
Yeah, I think we'll also dive into that subject as to how would you even implement AI in some of these like practical infrastructures that already exist in terms of workflows and other institutions in healthcare. I mean, do you have any other perspectives, I guess, from the data side, in terms, especially from an insurance company's standpoint, as opposed to a practicing physician standpoint?
Insurance companies' perspective in terms of?
In terms of like why is the current system not personalized, and what benefits could personalization really give you?
So, I mean, generally, when it comes to insurance and healthcare, both industries suffer from, or benefit from, I don't know, politically correct, benefit from experts. So the experts usually believe they know things, and that's why you don't see a systematic platform of personalization. So in a way, in an insurance company, you've got underwriters, and they believe they're personalizing. Like the underwriter's job is to personalize your premium for you, or any sort of risk management strategy for you. In a healthcare setting, doctor is there to personalize your drug for you, or whatever, the dosage for you, and so on. So in theory, personalization exists, but the reality is that we are all unhappy with it up to some extent, based on experiences that we get. But I think in insurance industry particularly, I think what is happening is that since they see the effect quite visibly, it's a part of the existential aspect of them if they're not profitable, and so on, they could be more encouraging that area. And of course, culturally, there's a lot of work to do, but in general, that's something that is happening, but it's not widespread as we would like.
Yeah. So then, along the subject of scoping, you know, where AI could be applied, how do you look at the various problems in the healthcare system, and then try and essentially scope out where digital solutions can really add value? And then once you have a digital solution, and therefore you're capturing the data, and it potentially becomes a tractable AI problem, how do you decide which are actually problems that could be solved by AI?
I think, yeah, it's a good question, actually. Again, it depends. So
I guess from your perspective, perhaps, in like the everyday.
Yeah.
Like what problems are you dealing with every day that you think, you know, digital
So
could be the way forward?
Yeah.
And after that, you know, AI could evolve what the digital has done.
Well, I think you have to realize that unfortunately some parts of the health system are still in the Stone Age as opposed to the digital age.
Yeah, that's why.
People are using fax machines, bleeps. I mean, it is unfortunately quite archaic with also snail mail. And digitalization obviously offers opportunity to have radical improvements in efficiency from the operational standpoint, but also consistency and reducing litigious risk potentially as well. That's just digitalization. AI, I think, if I had to just base upon clinical experience, so yesterday I was in A&E, and there were quite a few patients who I saw who didn't really, frankly, need to come to A&E. They could see their GP or even manage themselves at home. And there are definitely a couple of startups looking at this already, but having an AI platform which would be essentially a symptom checker would be quite helpful. The evidence for that is patchy, yes, but obviously the more information you can feed this type of vehicle, the better it'll become. And I think it's about creating a safe environment for that to be deployed.
Yeah.
and in turn become robust.
I think one way to think about it is, I usually think about it this way at least. I mean, think about the world in two axes. One axis is the complexity of the task. Let's say that's x-axis. And then the y-axis is the level of skill it requires to be done. And then let's say there's a line in the middle that says you're doing the task that is right for your skill. Yep. When you go under that line, it means that the task is more complex than your skill. When you go above that line, it means that you are doing something that is boring for you. You're a surgeon is doing blood pressure measurement or something like that. So I think what machine learning apps can do is usually to kind of empower any individual within the healthcare system to kind of go a little bit further on the right towards right side on the x-axis. Like a nurse with a risk assessment app on their iPhone, which looks at the typical data a nurse collects, can identify if you're at a high risk of cardiovascular, for example, mortality or event. So if a nurse can do that, usually there are some remedies or treatments that the medical evidence is so strong for that even in today's practice, we're not complying with it. Like, for example, I don't know, let's say high cholesterol and a statin is pretty much a match made in heaven within every guideline as well as every healthcare practice. But it doesn't happen because sometimes, for example, people might not comply with it for some other reasons. So in a way, on these sort of situations, when we know that it's a very straightforward process, there is enough evidence, and practice should comply with it, and a nurse with the right app can assess the risk and also prescribe even some sort of very basic medicine. I think these sort of stuff definitely can be streamlined with AI. And you can go further and further ahead, and depending on how far governments are allowing the regulation, you can allow AI to play a stronger role. But generally, I see the minimum role of AI being something that empowers medical staff across the whole spectrum to go further on that x-axis so they can sweep a wider range on the y-axis. Then, for example, on the medical imaging side, for example, which is a field that I did my PhD in, it's quite straightforward. I mean, like, human eye is not, it might be trained on looking at certain patterns from childhood to the end, but, for example, medical image is not one of them. So it takes a lot of training, and usually there's a lot of mistake, and there's a huge amount of evidence that shows that machines are better, superhuman in their performance. So a lot of these applications definitely could be streamlined.
I think that's a very good point in that what artificial intelligence does is it basically it upskills every single person along the chain of healthcare. So it can upskill the patient to diagnose their own disease, it can upskill the healthcare worker to prescribe, and it upskills the general doctor to prescribe specific cancer drugs that they might not, or to at least understand the kind of information around cancer drugs and diagnostics that's much more complicated than their level of training. So it increases access to information in the way that the internet has done. I think that the really interesting one aspect of AI that I'm excited by is the black box of post-discharge. So what happens at the moment is when you discharge someone, you send them out into the ether, and you have absolutely no idea what happens to them. The best bet you can have is ringing up their GP and saying, please, 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 can you go in and see them 2 days later and do X, Y, Z? You have no idea if they do it. That's if you get through to the GP, because there's no hotline. And so, there's a number of different companies starting to do this. Some of them are, so I'm trying to do it for kind of broader outcomes, which are more psychological metrics, but there are some that are doing remote monitoring for chronic ambulatory care sensitive conditions like heart failure and COPD, where essentially you're trying to look at someone's vital signs data in the community, not just in the hospital, and see and predict at an early stage if they're going to deteriorate. And we already have people doing that in the hospital, but if you can do that before they get to the hospital, you can reduce the admissions. What's interesting here is that predictive analytics in healthcare is a really transformative approach, because healthcare is basically reactive. So doctors are trained in asking questions to find problems and in treating problems. But if you've got healthcare that's predictive, how the hell do the clinicians actually act and behave in that context, because they can't find a problem? And also, there isn't any evidence base of what to do at that early stage when you manage to find someone who's decompensating before they show any signs of it. So I think for me, the interesting aspect of all of this is how do you redesign the system and retrain the clinicians to use some of these algorithms, which is, it's all about the design of the problem.
Yeah, I mean, I think that's a fascinating sort of question. I would definitely pose that back to you as the experts. But like, what's the other ramification that you might have when you're using an approach that can discover new features and correlations of those features with health conditions that might not have been documented in the past, and then try and also develop an evidence base for how you should deal with those. I think on the phone earlier, yesterday, we were talking about trying to segment patients for risk of developing a certain condition, and if the underlying variables that essentially dictated how that correlation was made are not unpublished features, then how does one really extrapolate from that? An understanding of why that person was in that condition, and how do you treat?
I think fundamentally, I think there are a lot of different views on this side of the story when we talk about a feature space being mapped to an outcome space. Like usually every model, I mean, I might be generalizing, maybe 1% here might be treated unfairly here, but majority of the models are based on certain assumptions, and depending on the assumptions that you make, and for many cases, the features that you feed to the model, you might end up seeing a certain pattern that might be suggesting that this is the reason certain things are happening. As a result, I believe that if you want to base your everything in one's healthcare based on a model, I think these are a very starting point of the problem where, for example, if you're using, look at most of the epidemiology models. They're usually using 3, 4, 5 variables. Maybe interaction with age is also reflected in those linear models, and then they find that, for example, blood pressure is correlated to your mortality or something like that. But if you bring 5 other variables in, and instead of a Cox's proportional hazard model, you start using a less parametric model, let's say, for example, a random forest model, or if you have got the luxury of a more advanced representation and use deep learning or something like that, you suddenly are talking about a different implication that you get from the model. And I think that's where it gets very difficult, that one NHS practice might be using a Cox's proportional hazard, the other might be using a deep learner, hence the verdict might be slightly different in terms of what's causing things and also who is more risky than other. So I think that's why I think the most ideal path, until we have a strong evidence for it, is to use machine learning more as a tool for empowering rather than taking care of things on its own.
Yeah, I completely agree with that. It is an enabler that can be used across the spectrum of healthcare. But in addition to predictability, we also need to consider impactability. So the patient who can be prevented from being admitted to hospital, getting cardiovascular disease, having type 2 diabetes. And it's the impactability that will allow us to identify the quick wins for AI/ML. There are probably 3 trends that every health system is trying to move towards, and that's going from volume to value, from episodic to continuous care, and also from reactive to proactive. And AI, again, can enable each of those changes, touching on what you mentioned before about identifying risk factors which we perhaps wouldn't have even considered, and bringing together different pieces of the healthcare puzzle together. That is us trying to achieve a more consistent, continuous, holistic health system. The third piece that I probably want to touch on is that there is this ongoing tension between consistency, as Cosimo touched on, protocols and so forth, as we have national standards, regional standards and so forth, but also to protect us from litigation and other pressures, the fact that there are regulatory principles as well, and then also personalization. And navigating that tension between consistency and personalization is probably one of the major hurdles that AI is going to have to think about, so to speak, over the next couple of years.
Yeah. And so when you think about developing solutions to some of these issues that we've been talking about, like what are the different moving parts that one has to consider, and maybe perhaps talking about some of the projects that you're working on, how difficult is it to come from the standpoint of I faced a problem as a clinician and I know what the solution should look like, but I'm dealing with N factors here that each have their own inertia that may be stopping you from realizing that solution or encouraging you to do that. Like, can you walk us through some of those moving parts and to realize how far we are from really seeing some of these solutions in practice?
I can talk about hospitals, but only hospitals, because that's my experience. But so within that context, yes, the challenges are not technical. The challenges, at least as far as I've seen, are more to do with the organizational change, so the transformation that's needed. And you need people who are really good at change management in large organizations, which often tech companies aren't. and it's interesting, actually, I've spoken to a few companies who say, we thought we were going to sell this algorithm. Actually, we're becoming a transformation company. We go into the hospital and help them change their workflow. And another problem is the politics. So, you know, people buy a particular software system and that's their stamp on the change in the organization. They hold on to it for many years, and also the contracts, obviously, as we all know, are 10-year contracts. So politics and organizational factors are the ones that I see a lot of the time. I don't know what your perspective is on GP and everything.
Yeah, I mean, so there are a few hurdles at least. One is the fact that the system and clinicians, managers, everyone, the whole entire NHS workforce, also in the private sector, is under significant pressure at the moment due to socio-demographic changes, but also funding constraints. And that pressure means that taking time out of your day to think about, oh, how can I use this AI platform and build it into my next consultation when you've only got 10 minutes to see the next patient and they've got 4 different issues they want to talk about is challenging. So creating the breathing space and the headspace for clinicians and the frontline staff to do that is one real issue. The second is probably capitalization. And so if you are a company who has a big data or an AI-based solution, expecting a hospital which has a myopic single-year funding cycle to say, okay, we're happy to invest a couple of mil in this upfront is going to be, again, challenging. And so you need to think about innovative funding or reimbursement models to try and be a complementary partner to some of these hospitals or GP practices. And the third is we need solutions to actual problems that hospitals are facing. I mean, obviously, it's great trying to think of new ways of approaching healthcare issues, but given some of the pressures, unless you're adopting a direct-to-consumer approach where consumers can make up their own mind as to whether they want to invest and purchase your product, it can sometimes be challenging for a manager of a ward in cardiology to have the latitude to think about how they're going to deploy this new way of working or this new technology. So those are probably just a few issues that we need to think about. Yeah.
I think on the change management side, I agree. I mean, so I remember like 3.5 years ago when I started the science team in AIG, our goal was to bring AI everywhere. And then we went in and we realized that a couple of years in, we were explaining standard deviation to people who forgot their high school math. And so it takes a lot of effort to basically bring these sort of stuff to the front line. So in terms of like people being comfortable with it, that's a big part. Like usually people are used to what they call like the basic models that are based on hundreds of assumptions that at least if the assumptions are correct, interpretation is easy. And then when you want to bring advanced models that are quite good at predicting things, leverage a bigger set of predictors or features, usually the problem is you start losing that aspect. Because from a human brain perspective, it's very difficult to keep track of a 10-variable world or 15-variable world and so on. So I think that part becomes very, I mean, inherently that's very difficult. And a big part of the problem is that people usually are trying to fit the AI-driven solution inside their existing world. Yeah. So they believe that I want to do business as usual, an incremental component comes in, which is an app that does X and Y and Z. And the other problem is that you end up, if there is a team whose job is to provide these sort of apps, you end up providing multiple of them. And then these people are feeling that they've got their usual day-to-day job, there are 10 extra apps they need to take care of, and then suddenly they feel like nothing is doable, and they ignore the whole AI community's push to change their way of work. And that's pretty much the case in a lot of digital health startups in the healthcare as well, where a lot of them were, for example, charting blood pressure or providing beautiful graphs on iOS for example, I don't know, number of steps or whatever. And then practically, they were not adding too much value to justify the burden they were putting on their users within the healthcare systems. I think that's fundamentally a big problem. And I think usually the part that I saw AI solutions being quite easy to roll out to the front line were places that you were doing basically greenfield projects. Like, for example, right now, there is a trial that we are doing in Iran where we are running it in the most rural parts of the country, like near the border with Iraq and Turkey and those areas. So those are the villages that are in the highest mountains of the country, usually snow-covered most of the year, and then you suddenly have got health centers that are servicing a village with maybe 20 people. So if they want to go to doctor, they've got a long way to go, and there is no alternative really. So basically, they're not aware of their risk, first of all. That's problem number one. When they're aware of it, the solution is you go to a doctor, and then you should do it quite often. And usually, they are at that stage when there are multiple risks they need to take care of, which means there are multiple drugs they need to comply with. So all these problems lead to a place that they let go. So what we are doing there is that the Ministry of Health, it's a Wellcome Trust funded project. The Ministry of Health there allowed health workers to take a more kind of significant role in the process of delivery of care. So what's happening there is that we're using point-of-care testing to assess people's risk, and then the app gets the data, measures the risk, provides the feedback to the health worker, which says the risk is high, and then, for example, there are certain very basic pharmaceutical prevention protocols that basically high-risk individuals go under. So I think that was quite easy to roll out because, first of all, the evidence for it is quite strong. It's hard to say basically this is a risky process because it's basically every GP and everywhere in the world, NICE guideline, everywhere you look at, recommends this approach. But since there is no immune system that you're fighting against, like NHS, if you go in, suddenly you get rejected. So there, basically, we are talking about the most rural parts of the country. There is no existing solution, and this suddenly becomes quite a popular solution. And I briefly mentioned it to you yesterday. I was talking to a friend once, and he was saying, historically, doctors in the UK used to go to Africa or somewhere like that for tropical medicine courses. And it's not far from seeing doctors from the UK going to developing world for learning about digital health. Because I think since there is no status quo, usually AI, digital health, is quite easily rolled out there and is adopted much easier.
Yeah.
That's a nice example of AI actually not being used for personalized medicine, but being used for the distribution of pro forma personalized medicine. Yeah.
Exactly. On the personalized medicine side, the big problem is that if you look at the amount of data, let's say young, middle age, old, and then look at the amount of data, most of the data that we have is the traditional medical data is more skewed towards the older age. At the same time, if you look at the VC investing that is happening in this space, it's usually on the younger age, like develop an app to count the steps or develop this or that. And then if you look at the gap in the evidence and practice, is usually in the middle of the spectrum, where there's a huge gap between what evidence says and what the practice is. And I think the lucky thing for AI is that the part that change is required and data is available is the part basically that are the same. And I think it's quite interesting that AI can target quite a nice range of mid-age to old age where there's a huge amount of data already and AI can add a huge value there.
Yeah, I mean, I think the beauty of AI is that it solves one of the dilemmas we've had for decades in medicine, which is do we need generalists or do we need specialists? And once you have a robust AI platform, it can be your cardiologist, your respiratory doctor, potentially your orthopedic specialist, all at the same time with immediate scale. And I think whichever company or research group can really crack that from a diagnostic point of view is going to be in a tremendously powerful position. Yeah. You will be hearing from Ali Parser shortly, I think, on that note. But yes, I think those are the two elements of AI that are particularly attractive.
But is that notion of decentralization of decision-making and diagnostic support and perhaps even coaching patients when they're in the outpatient setting to handle their lives in a way that can reduce risk of them redeveloping a condition, is that actually welcomed by the health system?
I would definitely say it is because...
And does it depend on different geographies? Like, is the NHS more forward-looking in that perspective versus the US healthcare system? Use it differently?
The US healthcare system, Medicare has just said they'll pay for Omada Health, which, I mean, I don't know to what extent the technology behind it is, but they do, I mean, they do care in the outpatient setting with behavioral health coaching. So yes, in an enormous way, it's very much supported.
I mean, the US spends $4 trillion on healthcare a year. Yeah. In this country, by 2020, if we don't make the efficiency savings we need to, we'll have a £22 billion hole that needs filling. So the financial pressure is really on, and then you have to think about how you're going to achieve sustainability in a health system. And one way of doing that is by, instead of putting the health system in the driving seat, you allow the patient to do that. And if you use AI to try and support them both from diagnostics but behavioral management, people can manage their own conditions as opposed to relying necessarily or as much on the health system. And that is one way in which you can create a strong degree of sustainability.
But yeah, I wonder what the institutions might be such that, well, that would be responsible for encouraging more and more patients to take ownership of their own health. And if we do have consumer-focused applications that are capturing data points about our behaviors and whatnot, like Omar is doing, how does that fit into this whole kind of minefield of disparate EHR systems that are logging data that's relevant to a condition that's represented by a certain type of doctor who uses a certain type of EHR, but that doesn't necessarily talk with the EHR of other doctors who serve other conditions of ours. Like how does
but
that?
I think in terms of patients taking care of themselves, I mean, that could mean anything. Like, I mean, we don't expect them to do their own surgery. It's basically like, of course, no, I'm not saying you imply that. What I'm saying is there are a lot of things that waste NHS's time right now that are like 10, 15, I mean, you guys know the stats probably better than me on that, but I think it's around 10, 15% of NHS GP time is spent on blood pressure management. I mean, if you see what they do, it's, I mean, anybody can do that. But the reality is people are not believing in themselves and doing that themselves. A bunch of tools and a good training could enable them to get to that level. And so I think it's fun. I mean, I agree that empowerment is not just about starting from nurse and going all the way to the best surgeons. It could be starting from patients themselves and going all the way to...
Definitely. Yeah, and I think so there's enormous savings to be made in terms of patients being empowered by having different kinds of intelligent software to use to manage their own health, depending on their impactability. But there's also enormous efficiency savings in terms of doctors' time, as you said, with blood pressure. You know, I'd say probably 70% of the work I do day to day does not need to be done by a human. And I don't think it needs to be done by AI, actually. It just needs to be done by integrated software. And then, so actually, hopefully, we'll be able to get rid of all of the junior doctors.
And there is, like, the whole concept of, follow-up is an interesting thing. Like, for example, actually, Neil was talking about Gaussian processes. I remember during my PhD, I was a huge fan of Gaussian processes. I was using it quite a lot. One of the examples that was there was around when is the best time to example. I mean, sometimes when you want to collect data from a sensor, it's quite expensive. Every sampling you do is quite expensive. So you want to define when is the next best time to collect a sample. So using Gaussian process, for example, looking at the spread of uncertainty, and you can decide at that point. But in general, like, for example, AI can do a lot of this sort of stuff. That, for example, a comprehensive blood test, do you need to do it every quarter? Do you need to do it every year? Like, for example, if there is a good AI algorithm that can identify, for example, maybe you're good for the next 5 years, maybe this and next. A lot of these things could reprioritize some of the activities and change the focus of the system as well as individuals within the system from one task to another. And that could suddenly change the whole the effectiveness of the healthcare systems.
Yeah, no, I agree with that as well. And the thing that kind of fascinates me is looking at some of the large software companies who are developing interest in the space. One of which I've been looking at is Apple. When you look in their iOS health app and you see all of the different parameters that could eventually be measured, and they've already generated profile pages to capture that content. And I just wonder, like, when the day will come when you can really capture all these behavioral and physiological changes that might be undergoing in your body when you're not in the clinic, and then be recording all of this to your smartphone, and then capturing, the inherited, information that you get from a genome and a proteome and whatnot, which is becoming increasingly cheap to sequence and analyze, to then have a far more holistic understanding of the nature contribution to disease and the nurture contribution to disease.
So we're already looking at that, and we partnered with Google Life Sciences, Apple, IBM, in addition to a whole load of SMEs and startups to try and tackle some of those questions. It is about data availability, information governance, but if you can give people, again, kind of the latitude to try and explore that, soften and ease in some of the barriers to exploring those opportunities, then hopefully we'll see some changes very soon.
Yeah.
And actually that's where machine learning will be most useful, because if you park all of that data into the doctor's office, they're going to say, well, I have absolutely no time and ability to understand what all of this means. Whereas if you can then create the platform that can draw out the insights to help the doctor make decisions based on that information, then that's where we're really important.
But as we were talking about earlier, then you still have to go through the process of generating an evidence base for what you do with that data.
I think that's an interesting
That's the
thing.
second part.
I think, the whole community of clinical trial is always thinking about clinical trial of a drug and so on. I think, but it's an emerging field right now around trialing digital health. And within that, you can think of AI. How do you trial an AI ecosystem that you're advocating for use in primary care or by individuals and so on. Yeah. I mean, we can think of it in two different ways. One is to say the adoption of a new solution within the healthcare system is going to be as it is today. Within that, then we need to start thinking about how to clinical trial the AI aspects or digital health aspects of innovation that is happening. Then the other thing is we can say basically by a lot of people starting using it without it being trialed, eventually it's going to pick up and we can start seeing its effect. I mean, but I think one weakness of AI community maybe could be that right now we haven't had enough AI clinical trials.
Yep.
So I think, like for example, you see probably a lot of these very basic drugs, generic drugs might have been trialed for many times and it's still being trialed, whereas AI solutions haven't. I mean, partly it's because of the initial inertia that might not justify a lot of effort, but generally that doesn't happen enough. So that could be a good entry point.
Yeah, and in addition to trialing, the discoveries from different AI techniques, you also need to trial the interventions. So you might be able to identify a certain pattern with someone's physiology or identify that someone's going to decompensate earlier, and you may have a clinical trial to show that you can do that effectively. But then the next stage is what does the doctor do about it? And so on top of that, then we need to trial the interventions and say, well, when you have this particular new insight, this is the new intervention that you can do.
Good. Exciting. So a lot of exciting things to come, and I think the future is quite rosy for benefits that we can bring to the healthcare system. So thanks so much for your time.
Thank you.